I'm Monica, and this is Ashley.
And today we're going to talk about how to deal with ethically challenging situations.
When confronted with an ethically challenging situation, it's always good to remain calm and respectful towards the patient and express yourself in a tactful and diplomatic way. Today, Ashley is meeting Mr. Smith for the first time to go over hip precautions, as Mr. Smith just had a hip replacement. Here is an example of the wrong way to express yourself when displeased with a patient's behavior.
Hi, Mr. Smith. How are you doing today?
I'm doing all right. How are you?
I'm great. My name's Ashley. I'll be your physical therapist assistant today.
All right.
All right, so we're going to be going over some hip precautions.
What is that again?
It's to make sure that you don't hurt yourself. There's some precautions you need to take since you had your hip surgery to make sure you don't hurt yourself. Are you all right?
Okay.
All right.
All right. Sorry.
Okay. So, you want to be sure to make sure that you don't...
Yeah.
Mr. Smith! That is very inappropriate! How dare you! Oh my gosh, Monica, you will never believe the dirty old man I just had to deal with.
What happened?
Well, I was about to discuss all of his hip precautions and exercises, and I lean over, and the little bugger squeezes my bum. God, this is not funny,
I'm
Monica.
sorry, that's disgusting. How inappropriate.
I know, right?
What a thing. Now here is the right way to express how you are displeased with the patient's behavior.
Hi, Mr. Smith. How are you doing today?
Oh, I'm doing good. How are you?
I'm great. My name's Ashley. I'm your therapist assistant, and I'll be helping you with some hip precautions and exercises today.
Okay.
All right. So, what I want to start out with is your hip precautions.
Okay.
Is it okay if I place my hands on your leg?
That's okay.
Okay. So, you want to be sure not to cross your midline. Mr. Smith, please don't put your hands there. I'm your therapist assistant, and we're here to concentrate on your exercises and your hip precautions. I would appreciate it if you kept your hands to yourself so we can continue with the session.
Okay.
Thank you.
Hey Ashley.
Hey, Monica.
I'm just about to go work with Mr. Smith. You just got out of a session with him, correct?
Yes.
Awesome. I'm going to work on him with ADLs. Any advice before going into the session, or?
Well, he did get a little inappropriate during our session.
Okay.
But I corrected him right away. I just told him to keep his hands to himself, that the session was about him and his exercises. And,
Awesome. Thank you so much for the advice.
you're welcome.
To conclude, always refrain from making quick judgments of the patient's behavior.
And remember to handle the situation in a professional way that is respectful to the patient.